everyone. Thanks for joining us. If you were tuned in a few moments ago, we apologize. We had a little bit of technical difficulty. So we're just going to pause for a second to make sure that all of our technology gets synced up so that we can begin the presentation this afternoon. Welcome back to the Facebook Live webinar series for Cornerstone Physical Therapy. And I'm thrilled to be joining you again today. My name is Dr. Laura Scott. I'm a pelvic health specialist, physical therapist here at Cornerstone Physical Therapy. In working with people who are pregnant and with the postpartum rehabilitation program is really my passion as a physical therapist. So I'm just so pleased to be able to sit with you today and chat about what physical therapy can do for a person who is pregnant to help them have a more comfortable, therefore happier pregnancy, to have a better birth experience, and to set you up for a better postpartum recovery. A little more about us at Cornerstone. We're a physical therapist-owned clinic, family-owned and operated, here for over 10 years. We have 3 locations in the Asheville area to serve you, and we're a practice of specialists. So in addition to orthopedic physical therapy, you'll find the following specialties in our clinics. Myself and my colleagues working in pelvic health, as well as orthopedics, CrossFit, lymphedema, massage therapy, and temporomandibular or jaw dysfunction. And I'll remind you folks, if you're tuning in for this webinar at any point, if you have a question, please feel free to drop it into the comments. Elise is with us today and she's keeping an eye on the comments. I'm happy to address them towards the end. If you want more information about our pelvic health program, about seeing a physical therapist for pregnancy or postpartum care, drop us a line either on Facebook or just give us a call at the number below and we will follow up with you. All right, so down to the fun stuff. I like to start by describing to my patients the physiologic changes that we're going through during pregnancy. And this helps us to understand why we have some of the side effects that we do during our pregnancy, and helps you and me as a therapist, helps drive our plan to help address that discomfort and mitigate those side effects to have a more comfortable and healthy pregnancy. Now, folks, this is by no means an exhaustive list, but just a couple of quick things to help you appreciate what's going on in your body. Respiratory changes, shortness of breath, more labored breathing. Of course, we can assume that as we get larger in our pregnancy, the pressure that we're putting on our chest is very real. But these changes are driven by hormonal, by other changes and systemic changes in our body. So a woman may feel short of breath. She's what we call breathing for 2, as early as 12 weeks into her pregnancy. Tremendous number of cardiac, or meaning heart changes during our pregnancy. It's normal to have an increase in your heart rate at different points through the pregnancy. So knowing what's normal and what's not normal and being able to monitor some of that during exercise is important. Hematologic or blood factors. It's normal at different times in the pregnancy to experience anemia. Because of hormonal factors, we have an increased risk for blood clots. So knowing about blood volume and being able to monitor your symptoms, knowledge of symptoms, for example, any kind of blood clotting, it's very important for us to consider if we're teaching physical activity and exercise during your pregnancy. And endocrine, that means hormones. It's all about the hormones. They are the signalers, chemical signalers, telling parts of our body to turn on or to turn off during our pregnancy. Many changes surrounding thyroid, of course the sex hormones, estrogen, progesterone, cortisol or the stress hormone, and all of these are affecting many different systems in the body. We can present with something like insulin resistance. That causes gestational diabetes. Hypoglycemia is not uncommon. So being able to pay attention to some of those symptoms as we're being physically active or exercise is important. Some of these endocrine factors, hormonal factors, which may have GI changes. Constipation is a common side effect during pregnancy. And these hormonal signals are causing our ligaments, that tissue that connects bones to each other. It's telling them to relax so that we can expand and make room for this life that we're creating. That has a side effect when it comes to musculoskeletal changes and physical activity. So a short list really in terms of all of the changes that are going on in the pregnant body, but these make for very real considerations when we talk about physical activity. Now, because the physical therapist, like myself, we are the musculoskeletal and the movement experts in the kaleidoscope of medical providers that you may work with, because we're really the musculoskeletal people, this is really where I hone in. And none of this is going to be news to any person who has been pregnant or known someone or loved someone who has been pregnant. So the musculoskeletal changes are tremendous. Weight gain is, of course, normal. Healthy weight gain between 20 and 30 pounds, that's our target today. That creates physical change and a different demand and load on your body. Postural changes. We see the arch in the back, the head shift forward, the shoulders may arch to accommodate for everything that's going on in our belly. Postural changes will change how you shift your weight and how you move around in space. Those changes, the weight gain and the posture changes, will create muscular imbalances. We have a different muscular demand than we did in the non-pregnant body. Working to overcome in this dynamic relationship is important to keeping us comfortable during our pregnancy. And again, back to that ligament relaxation. That's part of what creates these spinal changes that accommodate for growth, but it puts us at risk for certain types of injuries. It's important that the person who's pregnant knows how to protect herself during her pregnancy. So back to what we call the side effects. So knowing a little more now about the hormonal, the blood, the respiratory, the cardiac, and the physical, the musculoskeletal changes, then we can kind of better understand where these side effects come from. Certainly musculoskeletal pain, postural pain. That can be as simple as neck pain or back pain, but many of you may have heard of what we call pelvic girdle pain, maybe symphysis pubis dysfunction or the pubic bone. If there's some shifting, that can be quite painful. SI or sacroiliac joint pain, very common with my pregnant pelvises. Round ligament pain along the front of the body. So those are all related to particularly what's going on in the pelvis. We also can see nerve compression syndromes arise, carpal tunnel, tarsal tunnel in the feet as a result of the swelling and the compression in these delicate areas. Even a sciatica from nerve compression, muscle cramps. Common side effects of both the hormonal and the musculoskeletal changes. Renal side effects, kidneys, or what's going on truly with the bladder. We'll see increased frequency of urination, maybe urinary leakage, urgency, strong urge. In terms of the GI changes that we've mentioned, we'll see reflux due to the relaxation of these sphincters and the upward pressure. Nausea, of course, constipation, as I've already mentioned, as a result of increased levels of progesterone, and even hemorrhoids for some of the same reasons. And the cardiorespiratory side effects, that shortness of breath, palpitations, dizziness perhaps, and all of this contributes to a lower tolerance for exercise. So the right kind of exercise is important for the pregnant person. So as you can see, folks, pregnancy is hard work and it's a 24-hour-a-day job. So appreciate the load that your body is carrying. Working with a physical therapist who has advanced knowledge of the pregnant body, the changes that we undergo during our pregnancy is important to getting the right balance for your exercise and your activity plans. The way that a physical therapist may help you will touch on some of these different factors. Our job is to help you reduce that musculoskeletal pain. The body is changing and it's progressive, but we have techniques to help you address the pain, more postural and physical pain. Coaching on safety with exercise, no matter what your preferred form of exercise is. Guidelines for understanding how to exercise during your pregnancy, and developing individual exercise plans for that person based on your body and where you are in pregnancy. We're mitigating this bowel and bladder changes so that you can be more comfortable during your pregnancy and have some strategies for how to address those changes in the postpartum period. We're preparing for labor and delivery, working towards pelvic relaxation exercises, breathing techniques, teaching a woman how to push, advantageous body positioning. There's a lot that we can do to help you prepare for your labor and delivery. And then postpartum recovery planning. I love to have the opportunity to take a few moments with my patients who are pregnant to talk about their plan for helping their body to recover in the immediate time before you see your doctor at that 6-week postpartum checkup, what exercises and motions we can start doing right away, and what's better left for later down the road, what to expect, what's normal and what's not normal in terms of your healing timeline, and to have your toolkit well developed prior to giving birth. We'll touch on each of these a little more. Okay, back to musculoskeletal, body changes. How does a physical therapist help the person who's pregnant? So as you can see in this diagram, kind of describes the patterns of stress in the body as the baby grows. So the physical therapist is working to help adjust your alignment, not only through teaching and training and exercise, but we have hands-on techniques that if you have a dislocated rib because of that ligament laxity, you have an unstable SI or pubic symphysis joint, our hands are skilled to help put that back together. We use massage or what we call manual therapy to work with the soft tissues that may be tight to make you more comfortable or working back towards balance. We need to stretch the muscles that are tight without overstretching because we are more relaxed ligamentously in our body. And we need to strengthen the muscles that are becoming weak. So having a plan that targets these known culprits, what gets tight and what gets weak in the pregnant body, this is important information. In order to address pain, we need to do some ergonomic or some body mechanic training so that we're not repeating stressors, so that we are lifting or carrying safely, so we're preventing possible injury or discomfort. And we can help with strategies for swelling management. As we mentioned, that can be very uncomfortable. It can cause some of this carpal tunnel or these nerve compression syndromes. So that there's some advice that we have for our patients with exercise, with addressing the musculoskeletal postural pain. We can still be doing very important core training while you're pregnant. Of course, as a pelvic rehab therapist, the pelvic floor muscle group is our passion, but the pelvic floor does not exist all by itself. When we teach core training, core stability, we're talking about the pelvic floor muscles, this sling or this hammock at the bottom or the seat of the body that supports our organs. We're also talking about your abdominal muscles, the deepest layer of abdominal muscles. We're working with the diaphragm or with breathing techniques to modify pressures on the core. Deep spinal muscles that are helping your posture to stay strong amidst all these changes, keeping that pelvic girdle strong from the back. And of course, hips. So working with strong hips to maintain the stability of this system. So if you work with a physical therapist, these muscle groups will certainly be targeted in your core training that you're still safely able to do during your pregnancy. Let's prevent pelvic floor dysfunction down the road. Let's prevent diastasis recti or abdominal separation and learn how to recover faster. I won't belabor this list, and we're happy to send this list to anyone, an exercise professional or anyone who's curious about these guidelines for how to exercise during your pregnancy. But this should be a well-known list of guidelines to any exercise professionals or coaches that you may already be working with. Exercise is beneficial during your pregnancy when done safely and correctly. Certain things should be, you've heard already, they're kind of no-brainers. No more contact sports while you're pregnant. This is not the time for dodgeball. It's not the time for soccer. We're not scuba diving, right? We want moderate, low-impact exercise. We want to go for about 30 minutes each day. We want to limit the amount of laying on your back. That's what's called supine exercise for longer than a few minutes. After that first 16-week mark, that's going to be more difficult to do. We want to limit lying on the right side. Favor laying on the left side to reduce pressures on the heart. We want to avoid and really limit hips higher than the chest or inversion positions. We want to favor more of a cross-training style rather than an overtraining or a repetition of a lot of the same motions over and over again. We want to be very careful and avoid very intense stretching. We're already pretty flexible in our pregnancy. Gentle stretching is best. We want to avoid bouncing or swinging exercises, rapid changes in direction. Protect those joints that are a little more loosey-goosey right now. Stop before your fatigue. Stay hydrated. Again, we have those cardiorespiratory and those blood changes, so it's very easy to get overheated as a pregnant person. So stay hydrated, avoid warm exercise environments. Give yourself more time for your warm-up and your cool-down. Exercise in a temperature-controlled room, and focus more on relaxation exercise after about 34 weeks. So just a brief list of some of those very common exercise guidelines during your pregnancy. I mentioned previously that body mechanics can be very helpful to preventing injury, reducing re-injury, and repeated stressors during your pregnancy. And this is going to be very helpful information for your postpartum recovery period when you now have a newborn. So lifting and squatting, carrying, stairs, what we call bed mobility, easy techniques for how to move around in bed to be more comfortable. Transfers, that refers to changing your position. That might be getting in and out of a car, going from sitting up to standing, for example, going from lying down all the way to standing up. Some very helpful techniques when it comes to transfers and toileting as well. body mechanics on the toilet can help you be more comfortable, particularly with bowel movements, but also certainly with voiding and with emptying your bladder. So knowing, moms, if you've been there, you've been pregnant and you already have a toddler, how we lift your other little one is important during your additional pregnancies. And knowing that this is a marathon and that things like car seats, a lot of bending over, a lot of lifting and carrying are going to be a big part of your life. Knowing how to do so safely will make you more comfortable. So in conclusion, knowing how to move and having strategies for how to move with the changing pregnant body will make you so much more comfortable in your pregnancy and improve your knowledge for how to reduce your physical stress level in your postpartum period. Now, bladder and bowel changes. I could go on and on about some of these, but know that a pelvic health physical therapist, this is a lot of what we're going to work with our non-pregnant patients. So we have a strong body of knowledge in this area to treat or to work with some of this bowel and bladder dysfunction that can happen during pregnancy. We're teaching the pelvic floor muscle exercise, strength, endurance, and coordination. So that means relaxation as well as strengthening. We can help make some recommendations for you on your diet and your intake of certain drinks to reduce bowel and bladder, that's BB there, bowel and bladder irritation or sensitivity that make your bladder or your bowel more unstable or more prone to doing what you don't want it to do. Breathing techniques and some of those ergonomic body mechanics posturing for the toilet will make you much more comfortable when it comes to the bathroom. And finally, labor and delivery preparation as part of your pregnancy plan of care. In order to prepare for labor and delivery, at about 34, 35 weeks maybe, I'm coaching my patients to focus on pelvic relaxation exercises, appropriate positions and stretches, breathing techniques, because now at this point in your pregnancy, we want to promote baby coming down and baby beginning to make its entrance into the world. I coach my patients as well as their partners on perineal stretching. You may have heard of this already, this idea of perineal stretching and massage. So of the actual vaginal opening in the perineum to promote a better vaginal delivery, reducing risks for episiotomy and tearing. So knowing how to do this well can be very effective in reducing your risk of tearing. We want that tissue, that delicate skin there, to be soft and mobile and stretch, and we want you to get comfortable with the sensation of stretching in that area. And as I've mentioned, postpartum recovery preparation. Get a plan, feel prepared, know what's normal and what should change during that 4th trimester period of time. What can you start doing right away, and what's better left until more physical recovery has happened? I want all of my pregnant patients to leave our plan of care with a good plan in place to start recovering your body and being kind to yourself. So in conclusion, you deserve to love your pregnancy. It's such a special time in your life, and while it's special, many women do not experience that this is all roses and can be very uncomfortable, feel overwhelmed, and not having the tools to deal with these changes in your body. That's okay too. And I want you to know that a pelvic health physical therapist is here to be your coach to a healthy pregnancy. You should feel comfortable, you should feel confident, and you should feel prepared to go through each of these stages. Know that you do not need a physician referral to come see me as a doctor of physical therapy. All you have to do is give us a call, and our new patient coordinators will help double check your insurance, figure out your copay, and all of that stuff. Virtually every insurance provider covers physical therapy care, so PT for the pregnant person is not a specialty. It should be covered by most insurances. You and your physical therapist will figure out what kind of a plan works for you. I've seen women for as few as 3 or 4 visits, and I've seen women every week for the course of their pregnancy. This is about making this fit into your life based on your body and the kinds of changes that you're experiencing. You can drop your information in the comments below. You can call our office, and we will help you walk through the steps of getting a physical therapy care plan in place. So today you have 3 options to have a healthier and a happier pregnancy. We are offering telehealth at this time during some of the precautions that we're all taking during this COVID-19 health crisis. So we are offering telehealth as an option. You may also come into the clinic. Physical therapy as a healthcare facility is essential and open according to the Department of Homeland Security. So we are here in the clinic for you to begin your plan of care. Perhaps you may prefer to do a little bit of both. So that's your third option. Come into the clinic a little bit later when things calm down. Start with telehealth now. We're open to figuring out the best plan for you. So if you or someone you know is pregnant and think that you could benefit from having a coach to help you have a healthier and a happier pregnancy, please give us a call or reach out by email, by Facebook, and we'll put you in touch with the right people. So now, of course, I'll open for any questions that you have. In case you happen to be watching this video a little bit later on when we're not live, know that you can still drop us a note in the comments and we'll answer them and we'll get back to you in a timely way. And know that if you haven't tuned in to Ali Wong, I think that she is also an essential teacher on pregnancy for our culture and for our generation, so check her out on Netflix. So thank you so much for joining me today to learn a little more about physical therapy care for the pregnant patient, and we look forward to working with you. We hope everyone is being safe and enjoying some quiet time and maybe some more time with their family. Thank you so much.